Hello and welcome to CTV News Channel. Thanks for joining us. I'm Akshay Tandon. Some concerning new data on Canada's healthcare system. A new report says trips to the emergency department across the country are taking 20 to 30% longer compared to 3 years ago. The Canadian Institute for Health Information says the median length of stay for more urgent cases is just over 4 hours. That's 21% more compared to 3 years ago. For less severe cases, the median length of stay is 2.7 hours. And for those admitted to the hospital, the time spent in the emergency department has increased 5 hours. With me today is emergency medicine physician Dr. Warren Trisk of the Royal Alexandra Hospital in Edmonton. Dr. Trisk, thank you for your time here on CTV News Channel. Appreciate it.
Thank you for having me.
So this assessment, is it accurate or things are better or dire in your view?
I think it just is statistics proving what a lot of us in the emergency department have been saying for a long time now, is that resources are scarce. We do not have the capacity to look after everyone, and it is causing wait times across the board to go up.
So describe to us, what exactly are we seeing in the hallways, in the hospitals?
We are seeing too many people who need emergency medical care and not enough space to deliver that care in. And there is a combination of people who've been admitted to hospital who do not have a bed in the hospital itself and sit in the emergency department waiting. And then we see everyone else who has an emergency, an unplanned medical problem that they need immediate care for, who has nowhere to go. And so they get backed up.
I am just curious. So when you know that they need to be attended to and you and, of course, the staff is doing their level best, so how do you accommodate people who don't have a room to be in?
So they're not being accommodated well. If they're critically ill, then we find a care space. It's very difficult to do medical care in a hallway, in a closet, in front of the people in the waiting room. So we don't do medical care in spaces that don't guard people's privacy. No one wants to disrobe and be examined and tell me about their medical conditions in an emergency department waiting room or in the ambulance bay or outside in a tent. They want a medical place. They want a stretcher. They want a curtain. They want to know that their privacy is being protected.
But naturally so, of course, Doctor. But let's talk about in detail now. What is causing all of this delay and these increased wait times?
So the bottom line is that decades now of stringent cuts and fiscal policies have vastly under-resourced the medical system. And now Canadians, rather than paying for it with money, are paying for it with time. Time is money, and in this case, everywhere that we don't have the resources is reflected in time. When you look at your graph, the black boxes are the people who should be upstairs in the hospital, who have a condition so serious that only hospital care is adequate to look after them. And you can see they wait 16 hours, 18 hours. They are waiting a long time to be put upstairs. And everyone else is waiting as well because those people are taking our time and attention. And we can only look after people one at a time. As a physician, that's all I can do.
Right, indeed. And I know that, of course, you and all the teams of doctors all across the country are doing their best. But I want to talk to you about something else as well. You know, during the peak of COVID-19, Doctor, we had several conversations with healthcare professionals all across the country, talking to us about the strain on the healthcare system, the exhaustion, and how so many people are quitting the industry itself. And here we are, a couple of years later, and discussing the same issues. So my concern is that are the governments, whether it's provincial, whether it's federal, are they not listening? And if they're not, I mean, are you in a position to say, why not?
I would say they're definitely not listening because we have evidence in front of us. You don't have to look very hard in an emergency department to see a lack of resources to look after people in need. In an ideal world, no one would be waiting in an emergency room or in an ambulance stretcher or in a hallway because they have an emergency. And so the pictures that you're showing of people in ambulance stretchers, waiting in hallways, waiting in corners, waiting in wheelchairs, they all should be looked after in a timely fashion. That's actually the mandate of those of us in the emergency department. But we are juggling too many people coming too fast. We're drowning, and we have been for a long time. COVID provided an excuse that was there and easily understood by most people as to why some of these pressures were there. But if you go back farther, you'll see that the emergency departments have been overcrowded for 20 plus years without solution and without improvement.
All right, we'll leave it at that for the moment. Emergency medicine physician Dr. Warren Thirsk, appreciate your time. Thank you for joining us this afternoon.
Thank you for having me.